When looking at the forearm muscles, we have the extensors and flexors. With regards to the forearm and flexors and extensor muscles, there are so many, and they all sit on top of one another in different ways. So it's mainly on this one, finding where you feel you want to work, finding those particular spots, and again, what is it that you're trying to achieve? Yeah. The radiobrachialis that lives on the top just here does tend to be one of the main ones that gets quite tight, but again, really depends on what you're working on, whether you're working on tennis elbow, golfer's elbow, just general tightness, a pulled muscle, etc. So I'm just going to do a couple of stationary ones, and we're just going to go directly on the top just to show you that it can be done on the forearm, but as you can see, I've gone for a very small cup like I mentioned earlier, purely because of the area, and you can see as the skin is being sucked up into the cup, is creating that tension. Perfect. Obviously, if I wanted to do the other side, I'd simply roll my patient's arm over and I can come into the other side just there. I've gone slightly medially with my cups on this side because I want to try and avoid that midline a little. Try and avoid that gallery between the two bones, the radius and the ulna, that interosseous membrane, because that's where a lot of arteries, nerves, etc. live. So I don't want to put too much direct pressure through that middle section. So I've just gone off slightly. So we can either go in that space just there or more onto the radiobrachialis on the outside, just here. When it comes to the massage side of it, as always, once you're using the massage medium that you want to use, whether that's oil, wax, lotion, talcum powder, whatever it is that you're using on your patient, just something to allow the cups in your hands to slide over the area. We're then going to use the cups exactly the same way as you would on any other area. So you're going to choose a cup size that works with your patient, and we're just going to gently slide over those areas. You'll want to do smaller movements because they will keep popping off, even with the smaller cup. You start doing big movements, straight away it'll just pop off out of your hands. So you want to try and keep those movements a little smaller, just to try and keep that tension within the cup. And as you start to feel it loosen before it fully comes off, just put another little pump on. There we go. And as you see, I'm holding onto her wrist and I'm just guiding her arm where I want her to aid with the treatment. So at this point I can, if I wanted to, move on to the opposite side simply by turning her wrist. So I can work through these areas. Again, nice and steady. Small movements. You can try and go across, like I say, but just be mindful that because of the curvature, often they will pop off. So I find that going longitudinal seems to work the best, but just keep the movements small. And again, just using your patient's wrist to roll from flexors to extensors works quite nicely. When you find that particular spot that's quite tight, again, you can then put a cup on and leave it in that area, and then potentially get another cup and work around. But as you can see, these cups don't stay on very easily, so you might find when starting to work with another cup that it will start to take some of that tension out and it'll start to pop off. So on this occasion, you may find that actually leaving it where it is might work better than using another one. But we can always trial it, and if it does, then just go put them back on and then leave them alone. From there, you can do a pin and stretch in this position. So if we're doing the extensors, what we're going to do is we're going to flex through the wrist. So we're going to extend the elbow just here and then work through by simply flexing through the wrist just to create a bit of tension. So that would be a nice pin and stretch just there. And the same if we were to do on the other side to the flexors, we're going to then just extend through the wrist and create that tension just there. Okay. You want to support the elbow. I'm not trying to hyperextend it, but I am trying to just support it in an extended position and then put an overpressure through the wrist. There we go. I've actually got my finger on the top as well, which I can then feel and gauge how much tension is being put through that area, because I can palpate as I do the movement. Excellent. So that's how we would do stationary cupping, massage cupping, massage, and then of course pin and stretch. Ultimately, you need to find this cup size that's going to suit your patient. If you have a patient that has quite big forearms, obviously we can go for a larger size cup. However, you do need to remember that you have that curvature to the arm. And sometimes it's not the size of the area, it's more the curvature that we've got to be thinking about. And if it starts popping off, just reduce down to a slightly smaller cup.